Thank you and good morning to all. So, this is the article of 15-year biochemical failure, metastasis and salvage therapy and cancer mortality and overall survival rate in men treated with robotic RP in PSA-screen detected prostatic cancer. So we all know that robotic prostatectomy is a proper surgical management in the prostatic cancer. There's a lack of data beyond the 10-year, and this study aims to present the oncological outcome about the more than 10 years to 15 years. So 5 oncological outcomes were addressed in the last 15 years: biochemical failure, secondary therapy utilization, development of meds, PSA-screen, overall survival, and long-term predictor of disease progression also assessed in this study. So 19300% were underwent RALP in these 5 years. And based on screening criteria like patient to receive new adjuvant hormone therapy or the adjuvant therapy, patient lost to follow up and no information available, they were excluded. And after that, they had 1807 patient for the study. Parameter were used in the study was age, BMI, race, comorbidities, preoperative serum PSA, clinical TNM staging, operative nerve sparing and non-nerve sparing, pathological parameters like Gleason score, PTNM staging and surgical margins were all assessed. Patient was followed up like quarterly in the first year, semi-annually during second year, then annually. And biochemical failure, like defined as a AU guidelines. Only thing is that the imaging was done for to see METs was MDB, bone scan, and the CT scan, because on that time PSA PET was CT was not available. Not any PET was available on that time. About the salvage RT therapy was started to patient who has persistent serum PSA after surgery. PSA doubling time less than 10 months, PSA level more than or equal to 1.5 nanogram at time of surgery, or residual prostatic tissue, even if the serum PSA is less than 1.5. They did was something new in this. DMACO, we all know. What they did, they also include Diaz risk criteria that maybe this is not very commonly used. And it has 5 groups based on T staging, Gleason score, lymph node, and the margin status. So as the these things are involved, the group grade increases. Coming to results, as we can see in the chart, I median follow 14.1 year. If you can see all the red boxes, the most of the patients were Gleason 6 or 7, clinical stage T1, T2. Most intermediate or high risk patient. Pathological Gleason grade for intermediate immediate risk. Pathological stage was T2C and T3A. About 30%, there were no for nodal about the status. That means remove or not, that it was not known. Positive margin represented in 26 of the patient. And coming to Diaz risk, most of the patient, half of the patient, 1/3, of grade 3 and 4 group. Overall biochemical failure was out of 15 about 28.1%. In the DMACO risk criteria, it was for entry to high risk 38 and 44%. And for Diaz criteria, it was up to 89% in the maximum high risk, high group. About the metastasis, it was 4.02% at the 15-year of overall. And in DMACO risk, it was 13% at 15 year and about 60% on the high risk, highest group in the Diaz group. Coming to prostatic specific cancer mortality, it was 2.5% in the overall patient group. DMACO group, it was 6% and approximately 37% in the highest Diaz group. Overall survival, it was 82.1% at the 15-year of follow-up. In DMACO group, it was 75, almost 70-80% all the groups. And in the Diaz group, it was 67% and 73% in the last 4 and 5 group. Otherwise, it was more than 80% in 1, 2, 3 group. Secondary therapy was used mostly for the intermediate and high risk patient in the DMACO group and 3 and 4 group in the Diaz group. So they find that predictor of long-term disease progression, with the worst prognosis is the stage PT3B or more, pathological N1 disease, and Gleason score more than 8. In discussion, this study has 2 attribution, but commonly is like that is the longest longitudinal study which has a follow-up of the robotic prostatectomy and the contemporary PSA era. So if this study also compared the study with the pre-PSA era, that means the patient included, study started in 1980 and enrollment was done prior to 1990. If we can see all the about the metastasis, PSA-screen, and the overall survival all little bit how much higher in this study. Then it compared the early PSA era, that means late 90s and mid 80s to mid 90s. And it also show metastasis, PCSM, and the overall survival is also much better in the other studies. PSA era study, if it is compared, that means all the studies are done after the 2000, it is almost comparable, only the data having 15 years of analysis of in this study. What is the strength of this study is the probability of the oncological failure of pathological patient based on this characteristic, it can be identified, like PSA at the type of diagnosis, pathological Gleason grade, PST stage, neural involvement, and surgical margins positivity. So as significant factor associated with the disease progression, and it also it indicates that lifelong follow-up is needed. It is not like that we can leave the patient after 5 years, because if these factors are available. Limitations, definitely it is a retrospective study, and the patient on that period, Robotic was recently launched, and this 5-year, everybody was in their learning curve as a surgical and selection of the patient, everything was in the new. And overall outcome could be due to the less rigorous follow-up and under-reporting of the events. Result are from the single center, not the multi-center. This study was done. African American had only 5-10% in this cohort, not more. Reduction techniques were also not so evolved just like now today. So salvage therapy, effect of it, how is effect in the local recurrence, that also cannot be determined adequately. The most important thing, the PSMA PET was not available at the moment. Maybe the disease recurrence found on the NDP PET CT scan, maybe not recurrence, just maybe the fibrosis or something like that. So conclusion, men with clinically recurrent prostate cancer treated via the opportunistic PSA screening and treated with RALP achieve excellent long-term result. About 50 men die of the disease after 15 years of follow-up. And the result of this study could be a value in the preoperative counseling of the men considering robotic prostatectomy and management of clinically localized prostatic cancer and PSA screening era. So that is the only utility of this study at present. Maybe we need, when we include the data from 2005 to 15, maybe we have better outcome in that. Thank you.